Hello, bonjour. Welcome, everyone, and thank you for joining us. Bienvenue à toutes et à tous. I'm Perry Bolt with the communications team at Health Canada. Je m'appelle Perry Bolt. Je suis avec l'équipe de communication à Santé Canada. We are now commencing the event. Today, we will hear from Dr. Nel Wieman, Deputy Chief Medical Officer of the First Nations Health Authority, the Honorable Carolyn Bennett, Minister of Mental Health and Addictions and Associate Minister of Health for the Government of Canada, the Honorable Sheila Malcomson, Minister of Mental Health and Addictions for the Government of British Columbia, Dr. Bonnie Henry, Provincial Health Officer for British Columbia, and His Worship Mayor Kennedy Stewart for the City of Vancouver. Following the remarks, we will open the floor for a media question and answer period, starting online via Zoom. We will then take questions in the room. Après les remarques des orateurs, nous donnerons la parole aux médias pour une période de questions et réponses qui débutera en ligne via Zoom. Nous prendrons ensuite des questions dans la salle. In the interest of time, we kindly ask that you focus your questions on the topic of today's event. Afin de gagner du temps, nous vous demandons de bien vouloir concentrer vos questions sur le sujet de l'événement d'aujourd'hui. We will now begin with our first speaker. Over to you, Dr. Wieman.
Bonjour, Ani Haichka. My name is Dr. Nel Wieman, and I serve as the Deputy Chief Medical Officer at First Nations Health Authority. I'm originally from Little Grand Rapids First Nation, which is in Treaty 5 territory, part of the Anishinaabe Nation. And I was asked to join this momentous day today to offer a land acknowledgement. So I would like to welcome all the attendees this morning, and including those virtually, and acknowledge that the land on which we live, work, and play is the traditional, ancestral, unceded, and continually occupied territories of the Coast Salish peoples, including the Musqueam, the Squamish, and the Tsleil-Waututh nations, respectfully. And I turn it over to Minister Bennett.
Miigwech Nel, and hello everyone, and thank you all for being here. Avant de commencer, je voudrais reconnaître que nous sommes sur le territoire traditionnel non cédé des peuples Musqueam, Squamish, et Tsleil-Waututh. And I'd first like to thank Minister Malcomson for your leadership in bringing us together today as the Minister of Mental Health and Addictions here in British Columbia, and to address seriously the opioid overdose crisis here. So great to have the inspiring Dr. Henry here as well, whose advocacy on harm reduction has been so important across the country. And we're also pleased to have Dr. Nel Wieman join us from the First Nations Health Authority, but also as president of the Indigenous Physicians Association. I've been so grateful for her wise counsel over the years as a psychiatrist, a researcher, but also a role model. And thank you, Mayor Stewart, for your passion and leadership on this issue. Every day I think of that meeting with you in the fall as you described your weekly Monday morning reports on the opioid deaths in your city in the previous week. Every day I am reminded of the urgency of this crisis. Vancouver has always been a leader in drug policy in Canada and around the world. The 4 pillars of prevention, harm reduction, treatment, and enforcement started right here and then became the Canadian Drugs and Substances Strategy. For too many years, the ideological opposition to harm reduction has cost lives. British Columbia has been the epicenter of the overdose crisis and substance use harms for several years now. And in 2016, then Provincial Health Officer Dr. Perry Kendall declared a public health emergency. I also want to take a moment to thank him for all his leadership and his ongoing work to end this crisis. Since 2016, there have been over 9,400 deaths due to toxic illicit drugs. In 2021 alone, more than 2,200 lives were lost in this province. Thousands of families, support networks are experiencing this grief, some of whom have lost multiple loved ones. Despite the best efforts in increasing harm reduction, the crisis has worsened. The increasingly toxic illicit drug supply has exacerbated the already heartbreaking loss of life. Seulement, en Colombie-Britannique, il y avait en moyenne 5 décès par jour en mars. Chacune de ces morts a envoyé une onde de choc qui s'est répercutée sur les familles et les communautés. 5 familles, groupes d'amis, milieux de travail et communautés doivent vivre
Co-workers.
et leurs vies ont été irrémédiablement changées. For far too long, this wave of loss has been the reality here in British Columbia and across the country. Last March, Minister Haiju appointed an expert task force, co-chaired by Kwame McKenzie, Carol Hopkins, Mike Sir, and we thank them and the whole task force for their truly important recommendations. Their May and June reports called for bold action and significant policy change. Today, we take the first steps in the much-needed bold action and significant policy change. L'année dernière, comme composant additionnel à cette réponse, la province et Vancouver ont demandé une exemption en vertu de la loi réglementant certaines drogues et autres substances qui permettraient aux adultes à l'intérieur de la Colombie-Britannique qui sont en possession d'une petite quantité de certaines drogues illégales pour une consommation personnelle de ne plus faire face à des accusations criminelles. After thoroughly reviewing this exemption request and carefully considering the public health and public safety impacts, today I'm here to announce that I will be granting British Columbia's exemption request. As of January 31st, 2023, adults 18 and over in British Columbia will no longer be subject to criminal charges for the possession of up to 2.5 grams of certain illegal drugs for personal use, and the drugs will not be confiscated. Minister Malcomson and I want to be very clear. This is not legalization. We have not taken this decision lightly. We have been working with the province over the past months to ensure that their final application was able to meet the criteria necessary for Canada to be able to grant a province-wide Section 56 exemption to the Canadian Drug and Substances Act. This time-limited exemption is the first of its kind in Canada, and with it comes great responsibility for the health, safety, and well-being of the people in British Columbia, and a template for other jurisdictions across Canada. As part of the exemption request, the BC government is committed to a comprehensive implementation plan to ensure risk mitigation and support a full range of resources and services for people who use drugs. Aujourd'hui, l'approbation de la demande d'être accompagnée d'une lettre à la ministre de la Santé mentale et des dépendances de la Colombie-Britannique, Sheila Malcomson, où j'ai réitéré l'importance de remplir les obligations de leur application et notre engagement à faire cela en partenariat. Nous dévoilons également la lettre publiquement aujourd'hui. Throughout the exemption period, our government will work with the province to analyze the data and evidence and ensure that this exemption continues to be in the best interest for the health and safety of British Columbians. Real-time adjustments will be made upon receipt and analysis of any data that indicates the need to change. We look forward to undertaking this groundbreaking work with them in partnership. The dedication, commitment, and hard work of the province, as well as the municipalities, has provided the foundation for us approving this request. While approving this request is significant, it must be seen as one additional tool to be used in the ongoing comprehensive response to the crisis. Since 2017, we have taken significant actions and made investments over $800 million to address the overdose crisis and substance use-related harms. And today, as part of our government's commitment to support access to a comprehensive range of services and supports and making quality treatment, prevention, and harm reduction services accessible across the country, I am pleased to announce that an additional $11.78 million in federal funding for 14 projects through Health Canada's Substance Use and Addictions Program right here in British Columbia. By scaling up prevention, harm reduction, and treatment efforts, these projects will support people who are at risk of experiencing substance-related harms and overdose. Ce financement va permettre à des projets communautaires innovants de continuer de servir les gens qui en ont besoin. We know that more needs to be done here in British Columbia and across the country, and we will continue to support all evidence-based initiatives that protect the health and safety of all Canadians. Again, I want to thank Minister Malcomson and Premier Horgan for their leadership on this issue. And I again want to thank the City of Vancouver for pioneering innovative ways to address substance use for many years. There is much we can learn from these bold and creative efforts. Vancouver is the home to Canada's first federally approved safe consumption site, Insight, which is now one of 37 sites across the country. And in closing, I want to acknowledge the support of Chief Larkin and the Canadian Chiefs of Police, and once again, Mike Sir of the BC Chiefs of Police. As I said, no longer criminally prohibiting personal possession of small amounts of certain controlled substances is just one tool in a full range of solutions to fight the overdose crisis that we are facing. Notre gouvernement va continuer de travailler avec tous nos partenaires, incluant les provinces, territoires, partenaires autochtones, pour renforcer ces efforts. By working together to embrace creative, innovative, compassionate, and inclusive solutions, we will continue to work together to turn the tide of the overdose crisis, save lives, and create a brighter future for communities in the province of British Columbia and across the country. Thank you. Merci. I now will hand the exemption to Minister Malcomson.
Thank you. Thank you so much, Minister Bennett. This is a very important day. We're grateful for your presence and for your announcement. I'm honored to be here on the territory of the Tsleil-Waututh, Musqueam, and Squamish peoples. I hail ordinarily from Snuneymuxw territory, a place of great healing and a council and community that I've learned tremendously from about trauma, addiction, mental health, and recovery. The federal government's approval of British Columbia's request to decriminalize people who use drugs is a major step in changing how we view addiction and drug use in British Columbia. It reflects our government's agreement that substance use is a public health issue, not a criminal one. That's why British Columbia has been working so hard, building a comprehensive system of mental health and addictions care where one simply did not exist 5 years ago. We are addressing this crisis from every angle, including leading the country on prescribed safe supply and building new treatment and recovery services. Our BC government also took a leadership role in the class action lawsuit against opioid drug companies because it's time that they take responsibility for the human and financial toll their products have taken. But shame and fear keep people from accessing the care that they need, and the fear of being criminalized has led many people to hide their addiction and use drugs alone. And using alone can mean dying alone, particularly in this climate of tragically increased illicit drug toxicity. The coroner of British Columbia tells us that between 5 and 7 people a day in British Columbia are dying of toxic drug overdoses, and that half of these deaths are taking place inside a private residence, often when people are alone. Firefighters in Nanaimo have told me of the heartbreaking experiences of being called to an overdose death, family members finding a loved one in the rec room, already passed away, and the family had no idea that they were struggling with addictions or substance use. Fear and shame had kept their drug use a secret. Stigma and secrecy about substance use kills. We've seen that in British Columbia's South Asian community. Between 2015 and 2018, overdose deaths increased by 255% in the Fraser Health region. That's compared to 138% increase for other residents in Fraser Health. These deaths were overwhelmingly men, and most lived in private residences with their family. Almost everybody in British Columbia has been affected by these tragedies or knows someone who has. People on the front line are making heroic efforts to save lives. And yet, tragically, we continue to lose lives at a terrible and unprecedented level due to the terribly increased toxic drug supply. And even though we are adding new services in British Columbia almost on a weekly basis, we have not ended the public health emergency. Innovation and determination have been outpaced by the increases in illicit drug toxicity. And that's why British Columbia was the first province in Canada to apply to Health Canada to decriminalize people who use drugs. By decriminalizing people who are in possession of a small amount of illicit drugs, we are breaking down barriers that prevent people from accessing life-saving health care services. We would not be here today were it not for the advocacy of so many people in British Columbia. People with lived and living experience have been calling for decriminalization for years. So have calls also come from health officials, from the Union of BC Municipalities, from the federal expert task force that Minister Bennett mentioned, and from both the Canadian and British Columbian Associations of Chiefs of Police. I'm grateful for the voices of people like Dr. Bonnie Henry with us today, Senator Larry Campbell, Premier John Horgan, Mayor Kennedy Stewart, and Member of Parliament Gord Johns. We served together in the federal NDP caucus in the House of Commons. All have shown bold leadership. We built our application to Health Canada by relying on such voices. British Columbia brought together a diverse group, including Indigenous partners, people with lived experience, health and social service providers, municipalities, law enforcement, advocacy organizations, and clinical and research experts to craft our decriminalization framework. Our core planning table undertook the courageous work to bring many disparate interests together and create a broad consensus on the vast majority of the application. I want to especially credit our public service in my Ministry of Mental Health and Addictions. The heart and overtime that they have put into this work, working with the people most affected, has been inspiring, and it's what got us to this day, what got us over the finish line with Health Canada, truly. We will continue to rely on those voices, on those people on the ground who are most affected, to evaluate and monitor decriminalization in order to address any unintended consequences and ensure that people are not being recriminalized, and adapt our approach accordingly. Let me be clear, decriminalization is not legalization. Decriminalization removes criminal sanctions for possession of small amounts of illicit drugs for personal use. Drug trafficking remains illegal. Decriminalization will support enforcement efforts to focus on organized crime and drug traffickers instead of on individual users. We will take this year ahead to ready our justice and health systems for this groundbreaking and unprecedented change in Canada. Once implemented, those who have a small amount of illicit drugs, substances for personal use, will no longer be charged or arrested or have their drugs seized. They'll instead receive information about substance use and healthcare supports and referral to those services if requested. In the short term, decriminalization will stop seizures and arrests and connect people with life-saving supports. In the long term, decriminalization will help reduce barriers to accessing health and social services and stop the stigma that makes people use drugs alone and die alone. We will, as a province, continue to invest in prevention, drug testing, supervised consumption, treatment and recovery, and many more interventions, all to build a seamless system of care. We'll keep working every day to help people stay safe and access the supports that they need. There is more to do, and we need to use every tool in the toolbox. There is no one magic bullet to end the drug poisoning crisis, but decriminalizing people who use drugs is essential to stemming the tide of the toxic drug crisis and to reducing the stigma about drug use, which is vital to building a more comprehensive system of mental health and addictions care for British Columbians. With thanks to the Minister, to Dr. Wieman, to Mayor Stewart, I now introduce Dr. Bonnie Henry, British Columbia's Public Health Officer and one of the early advocates and activists for decriminalization. Thank you, Dr. Henry.
Thank you very much. And to start, I just want to say thank you to Dr. Wieman for getting us started in a good way here. As many people may know, I have been advocating for this as an important tool in our toolkit. It is not going to be the one answer to what we are dealing with here in BC, but it is a very, very important next step. As many people may know, since the report I put out called Stopping the Harm, Decriminalization of People Who Use Drugs in 2018, this has set a framework that we've been able to use to advance the discussion about this. And I am so very grateful to be able to be part of this announcement today. And I want to say thank you to Minister Bennett, Minister Malcomson, and Mayor Stewart. Today is a very important day, and it is hard to believe that we've actually got here. When the decriminalization report came out in 2018, there was not a lot of support for it at any level, although at the ground roots level, it was there. So today is an important day for people who use drugs, for their friends, their families, our communities, and people who work hard every day to support people who use drugs. The stigma and shame that goes with using drugs means that people don't reach out and have those conversations with their family and friends about their drug use. We know that shame is a very powerful emotion, and it keeps people hiding those things that they don't want others to know for fear of being labeled a criminal. It also means that they don't reach out to health professionals for support or to others who may provide them the advice and support they need. And with the increasingly toxic drug supply that we have seen, particularly in the last few years, we know that this means it can be fatal. We know that this was exacerbated during the COVID-19 pandemic when people needed to isolate at home. And we know that that meant a whole new group of mostly younger men who were living at home, who may have had those social connections, had lost those connections, and were using alone and are afraid or ashamed to talk to their family or friends about their drug use. By decriminalizing people who use small amounts of drugs for their own personal use, we are taking an important step forward to removing that fear and shame and stigma. And I know this will help people feel safer about talking to their friends and family about their drug use, having those important conversations, and accessing the life-saving services and programs they may need. This is not the one single bullet, the one single thing that will reverse this crisis, but we have seen clearly how important it is that this, along with the advancements that we're making in safer supply, will make a difference in curbing the tragedy that we have seen. I have always been committed to supporting people who use drugs, and one complex piece of this solution is this, right now, Section 56 exemption that allows us to start doing that work. And it is the start of a lot of work that we have to do. It's not perfect, but it has some very important key things in there that will make a difference, and we are committed to working with all of our partners, especially, and I want to thank the advocates who have been working on this for a long time, Mom Stop the Harm, people with lived and living experience. It is because of your support that we are here today. We are partners in public safety. And again, I want to also credit Chief Mike Sir for his support and advocacy along the way. And thank everybody who helped make this happen. We now will begin this important work together. And I'd like to now introduce Mayor Kennedy to give some remarks. Haitchka, merci, thank you.
Good morning, everybody. What a great day. Thanks, ministers, for inviting me to this very important announcement. And thank you, Dr. Wieman, and of course, Dr. Bunny Henry for all their work. First, I want to acknowledge we're on the unceded traditional territories of the Musqueam, Squamish, and Tsleil-Waututh people, and I thank these nations for their generosity as we move forward to build a true city of reconciliation here in Vancouver. As Dr. Bennett, Mr. Bennett mentioned, every Monday I have an email come into my inbox that tells me how many people died from the poison drug crisis here in Vancouver in the previous week. Yesterday morning, I got the email, 9 people died. And Vancouver Fire and Rescue Service saved 180 other people from overdosing. The week before that, it was 12, with 200 rescues. Week before that, it was 10. Week after week after week. One week, it was my own family member who was among those statistics. And you can't find a Vancouverite that hasn't lost somebody and is contained in those grisly statistics. But this Monday, yesterday, was different. I got the email, but Minister Bennett came to my office and said that the city and the province and the federal government are going to, they've reached an agreement on decriminalizing the simple possession of small amounts of drugs here in Vancouver and right across the province. And I can tell you, I felt like crying and I still feel like crying. This is a big, big thing. My first act as mayor in November of 2018 was to form an emergency overdose task force. And one of the boldest recommendations was to work with Ottawa to decriminalize the simple possession of drugs and pursue a Section 56 exemption from Health Canada, just like we had for the supervised consumption sites earlier this century. And I'm so incredibly heartened to say that this agreement today, granting such an exemption to the province, marks a new approach to tackling the poison drug crisis. Decriminalizing the simple possession of drugs is an historic, brave, and groundbreaking first step in the fight to save lives. It marks a fundamental rethinking of drug policy that favors health care over handcuffs. So I want to thank Canada's Minister of Mental Health and Addictions, Carolyn Bennett, for her commitment to this file. We've met many times, and each time our conversations have been frank, focused, and I know you truly understand the weight of this issue. Dr. Wieman, very great pleasure to meet you here today. Minister Malcomson, I don't even know what to say. We've been colleagues forever, and this marks a new height for us, I think. And Dr. Henry, I don't know what British Columbians say to you. I mean, you've been, so thanks. 2 healthcare crises and leading us superhuman is the way so thank you very much. I do want to thank some folks that aren't in the room here today. Our Chief Medical Health Officer, Dr. Patricia Daly. A very important player in this whole thing was Vancouver's Chief of Police, Adam Palmer. We have fantastic staff and consultants at the City of Vancouver that worked to put our decriminalization or exemption application forward. And also our Vancouver Fire and Rescue Services and peer responders for the work they do every day to save lives. But we're only here today because of the never-ending advocacy work of those who have lost family members and those that are responding right now to overdoses in our city and across the province. We do need to thank, as Dr. Bennett said, former Health Minister Patty Haydu and NDP Mental Health and Addictions critic Gord Johns for their work in this file, and I know there's other decisions to be made in Ottawa which I hope follow a similar path as today. The decriminalization of drugs has an unfathomably negative impact on the health and well-being of far too many people in this country. It unfairly targets those who are living with homelessness, experiencing mental health issues, that are racialized, that are Indigenous. Decriminalizing the simple possession of drugs will further remove police from the lives of drug users and instead connect them to a growing array of effective healthcare services. It also minimizes the contact between people who use drugs and the criminal justice system, reducing petty crime and freeing law enforcement resources to address more serious public safety matters. As Minister Malcomson and Minister Bennett mentioned, we still have a lot of work to do, though, to make sure that we guarantee dignified lives for drug users. We need to detoxify our drug supply with regulated, uncontaminated supply. We need to build more purpose-built housing with embedded healthcare supports and approve more supervised consumption sites. But we can't lose sight of how important this is today. This is a great first step. It's a historic, brave, and groundbreaking step in the fight to save lives from the poison drug crisis. And as Mr. Bennett said, this is a floor, not a ceiling. In other words, it's just a start. So again, incredibly proud and honored to be here today, and can't wait to tell others because they'll be all very happy to hear this news. Thank you so much.
Thank you, Mayor Stewart. Thank you very much to all of our speakers today. Merci à tout le monde. We will now proceed to questions from journalists online via Zoom. Nous allons maintenant prendre des questions des journalistes via Zoom. Over to my Health Canada Communications colleague, Andrea.
Merci, Perry. Thank you, Perry. Nous allons maintenant prendre des questions sur Zoom.
Going to be receiving the questions via Zoom.
Reminder that for Zoom participants, you can choose to listen to this audio in either French, English, or the original audio by selecting your preference through the globe icon. Pour les participants sur Zoom, vous pouvez choisir d'écouter cet audio soit en français, en anglais ou avec l'audio original en indiquant votre préférence sur l'icône du globe. If you wish to ask a question, please use the hand-raising function. I will try to take questions in order. Please modify your Zoom handle to reflect your name and the name of your media outlet. Si vous désirez poser une question, veuillez utiliser l'option de lever la main. Je vais essayer de prendre les questions dans l'ordre.
If you want to ask questions, please do.
Votre nom dans le Zoom pour indiquer votre nom et votre média. Merci de vous limiter à une question et un suivi afin que tout le monde ait l'occasion de poser une question. Please limit yourself to one question and one follow-up so we can be sure to get everyone. If you wish to ask a question, reminder to use the hand-raising function. Notre première question, our first question for Christian Noël, Radio-Canada.
Bonjour, thank you for taking our question. I'm trying to understand how many lives you hope to save with that measure and what impact do you hope it will have on the justice system and on the carceral system. But first, how many lives do you hope to save with that?
I think, as all of the speakers have said, that this is one tool in all of the harm reduction and treatment options, prevention, as well of all of the approaches to stop the deaths. What we're committed to do today is to put in place a robust set of indicators as well on both the public health and the public safety that we then will monitor in real time, that Minister Malcomson will have a dashboard with Dr. Henry to be able to just see what is happening in real time, and that would be shared with the federal government, and we will be able to ascertain not only how many lives saved, how many visits to the emergency department, how many hospitalizations, what, as you've heard, whether from the mayor about petty crime, about all of the things that we know are indicators of whether we are really stemming the tide of this crisis. We then will be in a position to evaluate that we are doing this to save lives, but also to give people using drugs the dignity and the choices that for them to carry on their lives and be able to be part of their families and their communities. So it is a commitment to measure exactly that, but not only those lives that are saved, but the people who almost died. I mean, to be honest right now, at the federal government, we don't have any data on the people who almost died. We get coroner data like 6 months later on the because until there's a coroner report, we don't actually know what the cause of death is. And so, you know, Mayor Stewart and Dr. Henry have robust data here in British Columbia that I think will really help us be able to work with Minister Malcomson to be able to plot that way forward, to make sure that lives are being saved. But also, I think what you've heard from everyone, putting in place a regulated, safe supply of drugs is the real antidote to the toxicity of the present supply. And so that some of the innovation, some of the projects that we're funding today are really, you know, last night I had supper with one of my friends who was addicted for many years and using drugs. When she read about what Dr. Christy Sutherland was doing at Portland Society in terms of being able to prescribe the medicine and have the pharmacist fill it and have the person out of the criminal justice system totally, that's where we want to go. We want to make sure that there is a regulated supply of drugs, regulated production, regulated distribution, regulated consumption, and that's how we're going to save the lives.
Thank you. My follow-up also is in regard of a potential flaw in the plan. If you look in Portugal, for example, when somebody is arrested, they are given a flyer and also kind of a date of appearance or a date where they need to go somewhere for a follow-up. There is nothing in here. So people getting caught with a small amount of those drugs will be given the flyers and then they'll go back in the wild. Why not follow closer what Portugal is doing and have a follow-up, so to make sure that those people actually do not escape the justice system if they are caught again and not following those steps?
So this is Sheila Malcomson, BC Minister. The Portugal model is something that our court planning table did examine. And because we designed our application based on evidence, we asked public health, we asked people with lived experience, does forced treatment work? And the answer that we got is no. And so that is a very important element of this application. No fines, no administrative penalties, no forced treatment. This is something that we heard from public health and from people with lived experience. We also hear, notwithstanding the efforts that we are making to build a continuum of care for mental health and addictions care, it remains a difficult system to navigate. And so this is something that we heard very much from police. They wanted to leave when they have an interaction with a person that is holding drugs, someone who uses drugs and is holding a small amount in personal possession. They wanted to leave that conversation. They're not confiscating their drugs because that further makes vulnerable people more vulnerable, but to give them that support in navigating at a local level the healthcare system and the supports that are available to them. Treatment, recovery, safe use, drug testing, there's a range. And so that's a very important part of the timeline that we have built in before implementation, that we are working with local service providers, with health authorities, with police to be able to help people who use drugs access and navigate the healthcare system, most particularly with that stigma removed so that people do not feel ashamed to come forward and ask for help.
I think that what we've seen is that some of the people who have used drugs have never had a trusting relationship in their lives. That when you see what happened with the Insight and then later On-Site, that people then have dignified choices about how they want to continue and to maybe think about a life without drugs or a life using drugs more safely. And I think that's why all of the pieces that are being put in place on safe supply, safe consumption, this is about people and listening to the people who have lived and living experience with drugs and not us making decisions top down. We have to listen to the people on the ground and the extraordinary people in innovation that of the care providers that really know what'll work and what won't work. And we are putting in place that kind of evaluation that will create the evidence that will make it I think, hopefully easier for other jurisdictions to follow suit.
Thank you, ministers. The next question goes to Ryan Tumulty, the National Post.
Yeah, hi there. Over the past couple of years, you've taken a lot of steps to move towards decriminalization. You've seen safe injection sites, supervised injection sites, as well as I know Vancouver police rarely charge for simple possession. I'm wondering why you think this measure will have a different impact on the trajectory of the crisis, given we've only seen deaths rise over this time.
Yeah, maybe. Dr. Henry, do you want to take that? Sure.
You know, I think there's a couple of things. And a few weeks ago, I talked about laying the foundations of what we know about people who use drugs and the crises that we're in with a Select Standing Committee on Health here in BC. And I would refer people to that because there's some really good information there that helps us understand the world that people are trying to navigate in that setting. I will say that this is one of those important things. We have what we call a journey map that showed a number of the interconnected issues that lead to people using alone and dying from toxic drugs in British Columbia. So decriminalization is an important concept for people who are in that cycle right now, where, and we've had a lot of media recently about the fact that over half of the women in our provincial correctional facilities are Indigenous women, and 80% of the women in those facilities are there for low-level drug crimes. And the disruption that has on their lives, on the lives of their families and their communities is immense. We need to get out of that cycle, and we need to be able to provide services for people and meet them where they are, but not leave them there, as we say. So it is about having another avenue for people. But there's also a second group of people, and I mentioned this a little bit. Through this pandemic, what we have found is the isolation that came with the lack of connection that we had. And for those who aren't here in the room, it's quite intimidating to actually see people in the room again, but quite lovely. It has led to another group of people who are dying at home alone. And because of that risk of being labeled a criminal, losing their job, not being able to get an apartment, not being able to travel, things like losing their children, it keeps them from talking to their family and friends about their drug use, and that keeps them from accessing services, being able to have drug checking or being able to use with somebody who can monitor them over time. So this is a philosophical approach that supports people who are using drugs in meeting them where they are, trying not to get them into a cycle that causes more harm. And when they are ready, and if they are ready, being able to access the services that support them in recovery. And we know that people's recovery journeys are complicated and they're personal, and we need to have many different supports in place when people are ready for that recovery.
I think, as Dr. Henry said, that the addressing the issue for people using drugs is a broad spectrum of people, and I think we're hearing from the construction industry, from Moms Stop the Harm, from even the debate in Parliament where we actually heard from so many members of Parliament about how this had touched their lives and the lives of their families. That these are not people who would be at a safe consumption site. They're not people that are going to access some of these other things we've put in place. It is the shame and the stigma of it that they may not even tell their family doctor. And so this is, I think, by us moving also on safer supply or a regulated supply, having more doctors comfortable prescribing, having other methods of getting safer supply to people who use drugs. We are trying to make sure that those people dying alone, as we've heard, who would not probably have accessed the other things that we've put in place, that this is another important step.
Yeah, hi. And then just to follow up, Minister Bennett, you have one outstanding request from the city of Toronto for a similar exemption. I know Edmonton has voted to send you one. I don't know if they actually have yet, but I'm wondering, is BC the model for these future exemptions? And are you prepared to grant an exemption to a city instead of a province?
Yes, I think that BC, the example of this successful application will very much assist other jurisdictions from making applications and knowing what are the criteria that need to be put in place, like BC has done in explaining that if you are going to divert people from the criminal justice system to health and social services, you also need to augment the health and social services. You need to be able to put all these things in place. And I think that the Toronto application from the Board of Health there is, we have begun to look at it and work with them. But as you say, that from Edmonton to the Saskatoon Police to Montreal, I think there are lots ready. And I think that today's announcement and seeing what was there in the BC application that allowed us to be able to approve it will be very helpful in allowing other jurisdictions to move quickly.
Thank you, Minister. And if I may ask, for the next reporters who ask questions, to help manage time a little bit, if you can indicate who the question is for, that would be most helpful. Thank you. The next question is from Jacques Galland, the Toronto Star.
Hi, good afternoon. Minister Bennett, my question is for you. On the 2.5 grams, advocates have said that's far too low. So first, I'd like to know if you could explain why 2.5 grams, and also should other jurisdictions that have submitted exemption requests also be prepared to have, 2.5 grams imposed on them? Is that the limit that Health Canada is willing to go to?
I think at the moment we have decided to start by starting. We want the evidence to show there's a difference between what has been confiscated, which is what the evidence that we have across the country and law enforcement, as well as here in British Columbia, as well as the RCMP, has been that 85% of the drugs that have been confiscated have been under 2 grams. And so we are moving with that. But again, as we put in place the applied research and the evaluation systems, that these are the kinds of things that we will address. We know here in Vancouver and we have heard from people using drugs that some of the daily consumption amounts are greater than that, but we actually want to make sure that this is safe and that there, with this being a cumulative amount, that there is a view that there have been examples where there is the ability of whatever amount to be pure fentanyl and then cut into many, many more doses. And so we're going to start by starting.
Thanks. And as a follow-up, I wanted to ask you then about the NDP bill tomorrow. There is a bill up for a vote tomorrow that would repeal possession offenses nationwide. Does the government support that bill? Will you be voting in favor?
I have some discomfort with the bill because I think it doesn't put in place the guardrails around implementation and how you would actually be able to ascertain thresholds, implementation, and so I will not be voting for the bill, but I know that we just want to thank Gord Johns for all of the work he's done in raising this conversation and making it really important. But in terms of our international obligations, in terms of what needs to be there, in terms of the safeguards, I think that it has been an important bill. But I think that starting with British Columbia is a prudent way to go.
Merci. Thank you, Minister. Et la prochaine question, the next question goes to Andrea Wu, the Globe and Mail.
Hi, thank you for taking my question. It was actually very similar to those two questions just now, but I did want to follow up a bit on what you meant specifically by the safeguards and the international obligations regarding the vote on tomorrow's bill, because as you know, there are those who are cynical of government and who see today's announcement as a distraction from that broader piece of legislation. So could you speak to those safeguards and international obligations that you find a bit concerning?
So in terms of the international obligations, there needs to be what are you doing instead? and I think that what we're saying is that we are dealing with our international obligations by citing the crisis here in British Columbia and saying that we're moving forward with this 3-year exemption in which we will be measuring all of the indicators to make sure, as we say, firstly, do no harm. That we want to make sure that we are moving forward in a safe way that's good for all the indicators of public safety and all of the indicators for public health. And as we do that together, then we can explain to our international partners that we have gone forward with our eyes wide open, and that we will be doing the necessary applied research and evaluation to prove that we're saving lives.
Thank you. Andrea, did you have a follow-up?
I do. By granting this application, that's a signal from the federal government that we see value in this exemption and in decriminalization, and that we are going to be saving lives by doing this. Would it not be fair to be applying this to all of Canada?
Well, I think that we want, it's as you know, with cannabis, it was 3 years of work to actually develop a proper implementation plan that was again around the regulated production, regulated distribution, regulated consumption. And so why it's really important we do this work with British Columbia now is going to be to show that we are very, very serious about how we move forward with this one tool of not charging people for small amounts for personal use, as we move forward on wanting across Canada to do way more on regulated supply, safe consumption sites. We've got to move on all of these things, but in terms of building the evidence for this exemption from the Substance and Drugs Act is going to be really important, I think, for the rest of the country.
Thank you, Minister. Et la prochaine question, the next question goes to Maura Witten, the TV.
Hi, Moira Whiten of the Tyee. Thanks for taking my question. My question is for Ministers Bennett and Malcomson. We heard today over and over again the importance of the increasingly toxic supply and driving the increase of deaths across Canada and in British Columbia. Where is the urgency you say is in today's announcement in terms of regulated and legal supply of known dosages of criminalized substances known as safe supply?
Yeah, please.
Thanks, Moira and the Tyee, for the question. So this is a really good opportunity to clarify what decriminalization is not about. It has nothing to do with safe supply any more than it has to do with accessing treatment beds. And I think because of the experience in Canada of legalization of marijuana, then it's easy to conflate these two. But it's just really important that we be absolutely clear that what British Columbia applied for was decriminalization of people, and the drugs remain illegal. So that And then my second point is we have added a whole lot of healthcare interventions that will become easier to access if we remove the shame and stigma about drug use. And that's why decriminalization is important. It removes a bottleneck to people being able to access detox, treatment, and prescribed safe supply, which is a medical intervention that we have available in British Columbia. There is not another province where someone with opioid use disorder or someone at risk of overdose can access safe supply through prescription. This was a public health order that Dr. Bonnie Henry stood up in the first weeks of the pandemic when it became clear that toxicity had skyrocketed and more people were using alone, as Dr. Henry has said. Last summer, Dr. Henry and I announced an expansion of prescribed safe supply, which we have now directed every health authority to implement. That work is well underway. Again, it's the first time it's been done in Canada, and we're very grateful to our health authorities who are fighting 2 public health emergencies and implementing a completely new program. That is the work that is within our provincial authority. Anything about non-prescribed safe supply is entirely in the federal government's realm, and so that's why it's really good for us to be working together. We're doing what we can within our provincial authority. And now that I have a federal counterpart, you'll remember that my ministry was the first in Canada. And when Premier John Horgan first appointed my predecessor, Judy Darcy, she was the first minister of mental health and addictions in Canada. Other provinces have since mirrored that. But now that we have a federal counterpart, it's an example of how we can learn from each other, work together, and to have that single-minded focus on the federal level. It will remove some of those bottlenecks on the federal side.
Yeah, thank you. And I think as we move on a regulated supply of drugs and for practitioners to be able to prescribe them, but for us to be able to work with pharmacists and find alternate ways of getting people safer supply of drugs, that we also are working on the supply side. Health Canada has approved the diacetylmorphine, the pharmacoscience application. We know that Fair Pharma is working on various other products, and that we know we've got to really sort of accelerate the progress to safe supply in that again, and as the really impressive of initiative of Dr. Christy Sutherland on the powdered fentanyl and working with people using drugs to be able to have them feel comfortable that they're getting what they need and that they will be safe. That this is a really innovative approach that we can do with partners in community, but also to be supported by the people at Health Canada in terms of the regulation. And others have thanked, but I just want to acknowledge the people at Health Canada like Shannon Nix here and the people that have been tromping the country with us, trying to make sure that we're listening to the people on the ground and able to respond to what is needed.
Thank you. And in terms of the threshold, I understand that this is decided on in balance of the Act's dual purposes for mitigating public safety and improving public health. However, as drug users have said, this is quite low and won't effectively decriminalize the people who need it most. How can you evaluate the impact of this proposal if it's not reaching the people who are most at risk?
This is exactly what we're going to measure, and working with them, we will put in place the indicators. And as Minister Malcomson said, if there's any evidence that people are being recriminalized, then that would be a very serious outcome that we are not wanting. What we are saying is that if we listen and learn and in that sort of complex adaptive system, measure, adapt, that is where we want to go. And I think that is exactly what is the plan in this pre-implementation period, as well as we get, develop the baseline and then measure all of the things that people using drugs are asking us to be measuring. I mean, as Garth Mullins would say, they want the cops out of their lives. So how do we measure that? And the Office of Public Prosecution for Canada in 2020 said, you know, they're in a guidance document, they are not to be charging people for small amounts for personal use, and so that there will be, you know, an evaluation of really the amount as we go forward. But we want to start by starting, and a lot of the people who are very excited by this announcement today are saying they never thought that this big steel door would be opened even a crack. And today we are, I think, here working with the province of British Columbia to say, yes, we needed the bold action and the significant policy change, and that we will continue to monitor and evaluate and adapt when necessary.
If I may add, the core planning table that British Columbia established with representation from rights holders, from people with lived experience, public health, law enforcement, academia. They helped build our application that we submitted November 1st. People sitting around a table together, virtually, albeit, but people really quite disparate interests that had not worked together before. I'm so grateful that they have continued to do the work, and hoping for a positive answer on our application to the federal government. They've been continuing to meet and helping us identify some of the sticky points in implementation and some of the communication, education, and police training that will be necessary. And so I am very much hoping that the members of our core planning table will remain in service to this cause, and that I, as minister, will be able to continue to draw on their advice and their collaboration to help take this time ahead of us before decriminalization comes into effect, noting that nothing changes until that effective date that's in the minister's exemption agreement. And so we have that time to establish the training, the public education, the anti-stigma campaigns, and the monitoring and evaluation that will be so important to getting this right and having the most benefit for people that need it and deserve it.
Thank you, ministers. And we have time for one last question. Nous avons le temps pour une dernière question. We will turn to you, Rochelle Baker from the National Observer.
Hi there. Thank you for taking my question. I am particularly interested in terms of reducing stigma, and I understand that it would take some time to train, but what will be happening in terms of policing and criminal records in the interim, but until the effective date goes in on January 31st? Will people be continued to be charged or their drugs possessed in the interim?
I think that what we've seen since the public prosecution guidance document, but also what's been happening in Vancouver for a long time, is that people have not really been charged, but they were having their drugs confiscated. And that, as you heard, leads to some risky behavior when people actually need their medicine. And so it is but I think that here in Vancouver, there's been a lot of work done on law enforcement education. There's been a lot of changing of the culture, the sort of presumption of innocence of someone using drugs as opposed to presuming they're a dealer. And I think that's the kind of education and the kind of work that Minister Malcomson and her team will be doing coast to coast to coast. We know there's quite a difference from Vancouver to rural and remote communities, First Nations communities, and Dr. Wieman and Minister Malcomson will be doing some roundtables with First Nations leadership and health providers, and be able to make sure that kind of training and that kind of, culture shift that reduces the stigma, and that this is that substance use and problematic substance use is a health problem, and requires a health solution and social service solution.
Thank you, Minister. So said another way, nothing changes until the effective date, which is January 31st, 2023. And that's because we have a significant amount of training to do a lot of culture change and systems change, and we really want to get this right. Where we are right now in British Columbia, notwithstanding the minister's invitation to go coast to coast to coast, we've got quite enough work to do right within British Columbia's borders, so we'll narrow that down. Several years ago, my colleague, the Public Safety Minister, Mike Farnworth, issued, I don't think it's quite a directive to police, but suggestion or encouragement to police not to enforce drug laws, not to charge people, and that has largely been taken up. But the reality is that is not codified. And so people really don't know whether they still might risk a criminal charge. So that's why we have initiated the decriminalization application. And then, of course, as Minister Bennett says, no longer having seizure of drugs is going to make a real difference in people's lives. What we do in the interim is going to be all about police culture training and working very hard on navigating those systems of access to make sure that police and frontline folks are able to help navigate people towards healthcare supports. And we'll just be having to communicate and reliant on the media too to encourage people that nothing has, notwithstanding this very important announcement today, that nothing does officially change until the effective date. And that's because we want to take the time to enact this major systems change, this real sea change, and get it right.
I thank you for that. The one aspect of Bill 216 on Wednesday is a measure to expunge or wipe criminal records retroactively for people who have had charges or records for criminal simple possession. Is that going to be, do you anticipate that this will be part of this exemption, or is that another step in the near term, one of the steps that you were referring to, Minister Bennett?
I think that's quite a separate issue. It was a separate part of the bill, including the third part of the bill, which was to set up a strategy, and I promise you we're doing that. On the expungement piece, there was a decision during the deliberations on cannabis that a pardon was the appropriate way. Expungement has been reserved for the things where there was a view, like with the LGBTQ community, that situation, and I am not aware of any departure from this in terms of what might be considered in terms of pardon.
Very much. That will be all for today's availability. Thank you for your participation. Any additional questions can be directed to Media Relations at Health Canada or the appropriate department or agency. La période de questions est maintenant terminée. On vous remercie de votre participation. Si vous avez d'autres questions, n'hésitez pas à communiquer avec le Bureau des relations des médias de Santé Canada ou le ministère ou l'agence applicable. Merci et bonne journée. Thank you and have a great day.